For the nearly 4,000 homeless people in Miami, living on the streets means dealing with constant hunger, poor hygiene, and a lot of misconceptions.
I think that a lot of people think that the population is violent, and I personally have not experienced that. I think that that was probably a stigma that I had coming in, but the more you talk to them, the more they just seem like they could be anybody that you know.
We have had some patients who've had family members who've had lots of medical care and medical expenses, and they've gone into debt because of that. That can happen to any one of us.
One of the biggest problems homeless people deal with is the variety of serious diseases.
A lot of people don't realize just how sick folks living out on the street can become. I mean, their average lifespan is nearly 30 years shorter than someone who is housed and in the same socioeconomic bracket.
That's why when Dr. Dan Burgholz got into medical school at the University of Miami in 2018, he started a non-profit dedicated to providing healthcare resources to the unsheltered. Its name is Miami Street Medicine. The team is made up of volunteer students from the University of Miami as well as some full-time employees. Every Saturday, the MSM team meets at Jackson Memorial Hospital in one of Miami's lowest income areas and goes on street runs to provide free healthcare to those who need it.
A huge portion of what we do is we do a lot of wound care. There's also a lot of derm issues that we handle. We get a lot of medications for patients.
And they also go one step further.
We can get patients that follow-up care if we need, if we can't address what they need on that run. We can connect them to somebody to make that appointment with a specialist or primary care physician.
However, setting up appointments and providing quality care to this community has become nearly impossible. In March 2024, Florida Governor Ron DeSantis signed a bill that will prohibit counties and municipalities from allowing public camping or sleeping on public property, and that would make the work of organizations like Miami Street Medicine much harder.
With the increase in criminalization of homelessness, folks are getting pushed around the city. And they're having all their medications, their IDs, their paperwork, their family heirlooms and things of that nature getting just destroyed in these sweeps.
No matter what happens, every single Saturday we would be on 17th Street, right? And so them being removed from there it has complicated a lot of cases because now we don't have access to them. We don't know where they've gone.
The bill says that the Florida homeless should be placed in temporary shelters monitored by law enforcement agencies, but that's not happening.
There are certain monopolies that are basically have created databases, and so they have basically implemented systems and data systems in shelters or places that offer resources where if a person is not registered with said monopolies, they won't have access to these resources.
Which is why organizations like Miami Street Medicine are more important than ever.
Right? It doesn't matter why you ended up in our care, what it is that you need, it doesn't matter. The fact is you're a human being, and at the very basic needs of being a human being, you have right to access and to medical care.
And that's why even with all the challenges the Miami Street Medicine team faces, its members will continue to go out every Saturday and help those who need it the most. For UMTV, I'm Harvey Duplock.